What's going on, you guys? It's your boy JT, and today we're going to talk about how to survive family medicine. So stay tuned. All right, you guys, thanks so much for coming back to my channel. If you're new here, go ahead and hit that subscribe button down below. This is a continuation of the series, How to Survive. So my previous video was how to survive internal medicine as a third-year medical student, and today's video is going to be how to survive family medicine specifically for third-year medical students. So what we're going to do today is talk about the family medicine shelf exam, how I prepared for it, and what it looked like for me. I'm also going to talk about just a regular day in the life of a family medicine third-year medical student. And then later on down the road, we'll also talk about how to best prepare for these exams, specifically the family medicine shelf exam. So stay tuned. All right, so the daily workflow and how it went for me was pretty standard. It was Monday through Friday, 8 a.m. to 5 p.m. Every single day, I would go to a specific hospital. In this case, I go to a specific hospital in Stockton, and I would basically show up, and on a piece of paper, there would be a list with my name on it, as well as the residents. So you'll find your name, find the resident, you'll basically shadow the resident, and there's multiple clinics for family medicine. For example, there is a specialty clinic for diabetes. There's a specialty clinic for sexual health. There is a specialty clinic for substance abuse. So every single day, you'll have a different resident, and you'll also have the ability to sit in different procedures, as well as different specialty clinics. So I thought that was pretty cool. So from 8 to 12, we would basically be in our morning clinic. And then at 12, I would have my lunch. And then at 1 o'clock through 5 o'clock, we would have the second half of the day at a different specialty clinic. And that's basically how it went for the first 4 weeks of my outpatient portion of family medicine. We were required to do 2 weeks of inpatient, meaning that we would have to go to the actual hospital, and if any of our patients made it to the hospital, we were responsible for their care. So for example, if we saw Mrs. Smith in our outpatient diabetes clinic, and then we received a call saying, hey, Mrs. Smith is now in the hospital, we would go and attend to Mrs. Smith, for example. So the inpatient was a little bit different than the outpatient. For inpatient, I was expected to be there from 6 o'clock in the morning to receive morning report from the overnight doctors. Then I would go ahead and round on my patients, and we would typically be done around 2 to 3 o'clock. Depending on the day and depending on the number of new admits, we may have to stay a little bit longer. But all this to say that if you're inpatient, the hours as well as the responsibilities varied a little bit from the outpatient portion. So whether it's outpatient or inpatient for my family medicine rotation, I would be off around 5 o'clock, and then I would go to the house and study for the rest of the day. And after I was done, I'd be able to obviously have dinner and then go to the gym and stuff like that. So that was pretty much the standard day for me. It was Monday through Friday. Luckily, we had weekends off, which is a huge blessing because in internal medicine, at least for me, I didn't have the weekends off. So it was really chill. I personally want to go into family medicine someday to eventually become a sports doctor. I'm also open-minded to change my direction, but for right now, I'm still interested in family medicine. All right, so how did I study specifically for the family medicine shelf exam? So every single person would always tell you, or at least they should, to know the USPSTF guidelines. I know it's a mouthful, but it's basically guidelines that independent researchers have done through decades of research to screen appropriately for specific diseases, as well as different cancers. So definitely know the USPSTF guidelines. Specifically know when a woman is needing a mammography, when a woman needs a pap smear or cytology, or when does a man need an abdominal aortic aneurysm screening and what that looks like. So definitely know those like the back of your hand. I also did 20 questions per day of the Family Medicine New World questions. I believe there was about 428 or so questions on the Family Medicine New World questions. And I also did the ambulatory specific questions as well. So I did the 400 family medicine U World questions as well as the 400 ambulatory U World questions. So I feel like that was sufficient enough for me to pass my shelf, but we'll go ahead and talk about that a little bit later on. I also did AMBOSS weekly quizzes, which our facility, our medical school requires us to do. And they were, so helpful. I also did Anki every single day, as long as I tried to at least. And I feel like that was also very useful for questions that I would get wrong. So I would get a question wrong on U World and I would make a card out of it and I would study that card basically every day. All right, so how was my family medicine shelf and how can you best even honors pass that shelf exam? For me, it was pretty variable. The questions were definitely difficult in the sense that I have never seen them before and it wasn't necessarily covered in our UWorld bank or our AMBOSS question bank. And it also wasn't very covered in the ambulatory question bank either. So I would say percentage-wise, I would expect to see about 25 to 50% of the material that you've seen in UWorld and AMBOSS question banks on the actual real deal shelf exam. And the other 50 to 75% will be just random questions about anything. It could be anything from breast pathology to anything to surgical. It'll just be very random. And for me, that was kind of like very frustrating because I expected to see the majority of my UWorld question-like questions on the actual shelf, but unfortunately that wasn't the case. However, I will say this though, I did pass and I passed with a pretty significant room for error. For example, I needed a 65% or greater to pass, and I got well above that 65% on my actual shelf exam results. So all that being said, you should still do all of the UWorld family medicine, all of the ambulatory medicine section for UWorld. If you have AMBOSS question banks, do as many of those as you can as well, but definitely UWorld family medicine, definitely UWorld ambulatory medicine, and as well as the USPSTF guidelines. A little hint, because I can't just type in USPSTF guidelines on UWorld, I would actually use AI. So like ChatGPT is a great resource just to go ahead and type in, please give me USPSTF guideline questions about XYZ and make them USMLE board style, and then ChatGPT will go ahead and just make you a bunch of questions. That's how I did well on the actual exam myself. Also keep in mind that the USPSTF guidelines aren't gender specific. For example, a man is supposed to be getting an abdominal aortic ultrasound at the age of 65 if they smoked 100 cigarettes in their lifetime. What about women? Do they need to be screened? So stuff like that, definitely keep in the back of your mind, okay, do women also need to be screened for this? Do men also need to be screened for this? Because that's something just to kind of look out for. All in all, I feel like the exam was made in such a way to where if everyone didn't do so well, you still did okay and you at least passed, if that makes sense. They kind of based it on a standard curve and a standard deviation from the curve as well. So as long as you do your world, as long as you do Anki, and as long as you do the USPSTF guidelines, even if all else fails, I think you will still at least pass the exam. If you want to get honors, here's what I would recommend. Although I can't give you material as to exactly what I've seen on the actual family medicine shelf, I can recommend the fact that you should definitely look at your family medicine core rotation when you're in person, shadowing a doctor, shadowing a resident. Ask them, what's the treatment for this that you're doing? What's the treatment for that you're doing? What's the treatment for this procedure that you're doing? If you ask those questions and kind of like jot them down and have them in the back of your mind, I think that you'll be in a really good shape to actually honors your shelf rotation. So that's all I'll say for the shelf exam when it comes to family medicine. All right, you guys, if you made it this far, I'm just gonna go ahead and give you my overall, family medicine review and how I basically survived and what that looked like for me. So all in all, after everything, I'm still interested in family medicine. But however, I will say this though, after working with residents for 6 weeks, it is unfortunate the amount of work that they have to do and the amount of patients that they are required to see per day. For example, a doctor should, give or take, have about 30 minutes to even an hour per patient to get a thorough history, a thorough background, and really just address every single one of their concerns. Unfortunately, I've seen it to where they have been double booking the resident for a specific time slot. Let's say that you're scheduled to have one patient at 8 a.m. They will schedule two 8 a.m. patients in the exact same time for one resident to see. So now that means now a 30-minute visit turns into a 15-minute visit. Keep in mind that they still have to type up their own notes, which is where we med students would come in. So I would go ahead and say, I'll type up the notes, or hey, I'll see this person and I'll type up the note. You see that person and we'll type up the note. All this to say, in a 4-hour time span, we as residents will see about 15 to 20 patients in that 4-hour time slot, unfortunately. So it's really kind of a bummer in that area, but the residents are doing the best that they can. And I'm thankful to the residents that I was able to shadow. I'm thankful for the residents that are able to teach me. Every single resident was a little bit different. There were some that I could tell I was just an annoyance and a bother to them, but there were other people that were just willing and really happy to have me and actually use me as a Spanish interpreter, as a note taker and a note writer. But it was a good experience overall. I will say this though, that surprised me. As a family medicine doctor, you can do a lot of procedures, which I think is really cool. For example, you can do like circumcisions, you can do wart removals, you can do toenail removals, things like that. So I like to work with my hands, so I'm still very interested in family medicine. All right, you guys, thanks so much for watching. I really appreciate you guys' support. If you guys have any questions, or if you'd like to see anything more, if you want to see more study tips for step 1 or step 2, or if you want to see more study tips on anything else, or if you want to learn more about even Caribbean medical schools, or if you want to learn more about medical school in general, or even admissions, please send me a message through my email or my Instagram, and I'll put the link to my Instagram down below, and I'll be happy to answer these questions that you may have. That's all I have for you guys. Till next time, much love, peace out.